Thanks for staying with us for TV5 News at 9. Now it is time for Medical Moments with Covenant Healthcare. We learned so much in these sessions. Joining us this morning, we have Dr. Aaron Smith, and we appreciate you being here. And you are an emergency room doctor, and so you have seen quite a bit. We are talking today about men's health and the unique challenges they face, and we should start by asking why it is so important for men to prioritize their health.
Prioritizing your health is super important. You think about, our bodies are just like very complex machines. Just how much, if you don't take care of your car over time, that car will not serve you reliably. And you want to have, you want your body to last, enjoy your retirement when we're blessed to get to our retirement age, and actually enjoy life rather than being, sort of broken down or having chronic illnesses that limit what we can do.
Is it fair to say that a lot of men fear going to see a physician or see a doctor? I know a lot of women do as well.
More than fair. More than fair. I think there's a lot of excuses. Men are great at making excuses as far as, I'm too busy. I've got to take care of my family. Some is just that, I don't want to admit that I'm a tough guy. I don't need help. I can do this by myself. But we worry more. Actually, there's changes in things that happen. Just our unawareness of this, say colorectal cancer. It's going down in incidence across the U.S., but actually it's increasing in younger people. And so most young people probably don't know that. So that's a change. That's something we need to be aware of.
What sort of health screenings, colonoscopy, I assume, but also what are some other health screenings that men should be looking for?
The common things, high blood pressure. Looking good for a blood pressure screening high blood pressure is, the silent killer. It puts you at risk for heart attacks and stroke and kidney problems. We mentioned colorectal health as far as, getting that screening test. The reason we screen for that is because we know what colorectal cancer looks like before it turns cancer, and we can actually prevent cancer. We don't want to find it late in life when you have metastases somewhere else in your body, and then the treatment is markedly different. Diabetes, knowing that diabetes is a contributor to many other chronic medical issues. It's a simple screening test. Getting your cholesterol panel checked. We know that the cholesterol is some of the fats in your blood. If those are out of range, that puts you at risk for developing plaques and developing heart disease. Mental health is also super important. Men specifically, prostate cancer is an issue. And starting at 50, you should have a conversation with your primary care physician about the risk and benefits of doing prostate screening exams and tests. Because again, this is something we'd rather catch earlier than later.
And for something, by the way, we should mention for the younger people that you say colorectal cancer cases are going up, is if it's a family history, should they also be speaking to their doctor?
For sure, even sooner. So historically, we started thinking about colorectal screening at age 50. And like I said, colorectal cancer in general is going down in incidence, but for the younger population is actually going up. It's increasing. We don't totally understand that yet why in medicine. But the screening, we start screening sooner. So the American Cancer Association is recommending at 45 now for the first colorectal screening. And if you have a family history of that, even younger. Wow. So those are the important things.
What do you think the biggest challenges are for men when it comes to maintaining their health?
Prioritizing that, for one thing. Looking forward to say, this is my body now, and I want to value my body moving forward. The other things are, time and day. All the things you have, all the responsibilities you have are very much a factor in that.
What are some tips, maybe suggestions you might have on incorporating physical activity and also, as you mentioned, mental wellness into daily routines for men?
Sure. It's funny you mentioned the two together because actually physical activity and exercise does actually help with mental wellness. As far as, we all feel in the world right now, the world's stressful. Things are happening, there's lots of stress on us. And depression and anxiety are real issues. Men have a hard time admitting that they suffer from those. But, getting, daily exercise or at least regular exercise. It doesn't have to be going to the gym every day. It can be just, find something you enjoy doing. It makes it much easier to make that a habit if you enjoy doing that. It can be, just a brisk walk. It can be if you're a yard worker, gardener, also mental health wise, interacting with your friends and your peers and your family, staying connected with folks. Getting enough sleep is huge. Most of us do not get enough sleep. We stay up till midnight doing watching TV on our phones, then we get up at 6 a.m. to go to work, and then we're just always, our batteries are always drained. You know, we should get 7 to 9 hours of sleep a day. As we get older, as I've getting older, I find that's very important.
Right. Well, how does Covenant Healthcare really support men in taking proactive steps to better their health, their mental health?
Sure. One of the, I think one of the best things you can do is actually get established with a primary care physician and have a relationship with a primary care physician that help you be aware of the things you're at risk for, to do those screening tests. And so we have a very robust network of primary care physicians in the area to take care of men and everybody here in the Great Lakes Bay Area. We do have a screening service and diagnostic exams for that, to catch things earlier rather than later. We have specialists such as urologists for men's health kind of things, if there's things with the prostate health or sexual health or something of that nature. And then we have specialists, if we do find something in those screenings that we need, cardiologists, oncologists, we have specialists that help support those as well. And we do education outreach, as far as we have, if you do have a chronic illness like diabetes management courses, something of that nature.
What would you say is your top advice? What is the one thing you want people to take away from this as far as getting men to get in and get checked?
Yeah, just make it a habit of keeping up, think about your future health, your future body, and invest in it now. So, having a sensible diet, make sure you're giving enough rest, make sure you're, staying active. Being active is very important for a long, healthy life. You want to enjoy life later in life. You don't want to get to the point later that because of your chronic illness, you can't do the things you want to do.
All right, these are some great tips. We appreciate it, Dr. Smith. We also want to let everyone know, too, if you want some additional information and some contact links, go to Hot Links, top of WNEM.com, and we'll get you connected.